If you're watching this is video number 6, but please watch videos 1, 2, 3, 4, and 5 first. They have some of the most important information, especially the first few videos. Okay, this is video 6, and this is regarding the research studies in relation to endometriosis and surgery. So this womenshealth.gov fact sheet on endometriosis, the full link is mentioned in a previous video. It says during a surgery to the abdominal area, such as a cesarean or C-section or a hysterectomy, endometrial tissue could be picked up and moved by mistake. For instance, endometrial tissue has been found in abdominal scars. So, I personally have very severe and somewhat advanced endometriosis in my body, and I had never had a C-section before. So I started looking into, I'd also never had any kind of abdominal surgery before. So I started thinking, okay, if these cells are something that can implant or be picked up and moved and implant and continue to progress, kind of like weeds or seeds in the garden that aren't what you're trying to grow in that area of the garden, some things are very good at spreading and seeding and taking root and moving around. And when I think about endometriosis, I really think about that. It's almost like seeds of a plant that are spreading and growing in the wrong part of the garden, and they're hurting the other parts of the garden really, really badly. Physically, emotionally, spiritually, financially, educationally, destroying careers and dreams, and just bringing you to your knees in physical pain, causing scar tissue and adhesions, making organs adhere to one another, causing extreme inflammation, painful bowel movements, painful urination, deteriorating surrounding organs, destroying ovaries, contributing to ovarian cysts, possibly contributing to the growth of fibroids, destroying fertility, causing organs to attach to one another, like my uterus and vaginal canal have attached to my intestinal walls that are backing at the back of my uterus. One of the things they're going to address in my surgery. So for me, I thought, this is interesting. And there are some scientists who have done some studies where they've looked at, I think specifically maybe in monkeys and some other animals, maybe mice, but they took endometrial cells and they implanted them in different parts of the body and just observed what they did in some of the sources that I read. So it seems like endometriosis, obviously by what we observe and what's happening in millions and millions of women, endometrial cells that are growing where they're not supposed to seem to have a great ability to spread and to worsen and to grow. And if you have endometriosis, you probably already know that the endometrial cells that are in the wrong parts of your body will bleed and shed and cause inflammation, scar tissue, and adhesions by reacting to your hormonal cycle that tells your uterine interior lining to bleed and shed when you have your period. Sometimes you can have pain, though, in other parts of the month, and I've experienced that as well. So surgery for me to treat my endometriosis has been my greatest godsend. It's been my greatest blessing. I found a wonderful surgeon, and my first surgery I had in November of 2015. I had it because I had a trip to an ER where I had, where they discovered I had a ovarian cyst on both ovaries that appeared complex, and one of them had been hemorrhaging. And it was the worst pain I think I've ever experienced in my life. And I've had a baby. I've been through a lot of different things. I've never experienced pain like that before. I thought honestly that there was a possibility I was dying. The way I felt in the ER when I was waiting to be seen was that that maybe one of my organs had ruptured and that I was bleeding out and dying, and they just seemed to be ignoring me. I think I waited in the waiting room for 8 hours before they took me back, and then I don't think I left until maybe 12 hours later. So it was a really horrific experience, but I found this great surgeon, and he's taking very good care of me. When he did the operation, the laparoscopy, and the exploratory surgery to look at my ovaries, he was able to peel off endometrial growths that were on my left ovary and save my left ovary, and drain the cysts that were on my right ovary. There was a lot of endometriosis throughout my pelvic region and scar tissue and adhesions. My right fallopian tube was very swollen and had damage. And then my uterus, they had also found a very small fibroid in the muscular wall of my uterine lining in the last ultrasound they did right before I had that surgery. I had had dozens of ultrasounds. What's sad is it did take, I had symptoms for over 10 years before I was diagnosed with ovarian cysts, and I had symptoms for over 10 years before I had the surgery that confirmed my endometriosis. I had had CT scans, tons of CT scans over my life, but just a few months before I found this wonderful surgeon, I had a CT scan at another hospital with oral contrast dye and vein contrast dye, and they couldn't see any endometriosis. You can't see endometriosis well unless you open someone up and look, and that's part of what makes it very tricky. I have this great quote on the wall over here, and it says, "For we live by faith, not by sight." And I think a lot of the healing with endometriosis is going to come when we start using our faith and stop looking at the cover of the book and judging things by the way they look on the outside. So surgery has been a hero for me. It improved my quality of life dramatically after my first surgery, and my second surgery is what I'm going to talk about in video 7.